Hello and welcome to our video today. In the next few minutes, we will be discussing the fascinating topic of wealth and health. How are these two areas interconnected? What are the impacts of wealth on health and vice versa? Let's delve into this important subject together. Section 1. Definition of wealth and health. Before examining the relationship between wealth and health, let's first define these two terms. Prosperity refers to the economic wealth and resources available to individuals or communities. Health, on the other hand, refers to an individual's state of physical, mental, and social well-being. It is important to understand that wealth includes not only material goods, but also access to education, health services, and social security. Prosperity can be defined as a state of success and prosperity in which an individual or community has sufficient resources and opportunities to lead a fulfilling life. It's not just about financial wealth, but also the ability to live a meaningful and fulfilling life. A holistic definition of wealth includes various aspects such as financial security, freedom of time, personal growth, family fulfillment, health, and feeling satisfied with one's life. It is about finding a balance between material and immaterial values and living a life that corresponds to one's values and needs. Health is a multidimensional concept that includes not only the absence of disease, but also a person's physical, mental, and social well-being. It includes the ability to perform everyday activities, maintain positive relationships, manage stress, and achieve high quality of life. Health is not only an individual good, but also has an impact on society and the economy. A healthy population contributes to productivity, reduces medical costs, and creates a better quality of life for all members of a society. The relationship between wealth and health is complex and interdependent. High levels of wealth can facilitate access to quality healthcare and education, which can have a positive impact on health. At the same time, good health can increase productivity and income, which can lead to greater wealth. There is also a close link between social justice, equity, and prosperity, and between environmental health and sustainable economic growth. It is important to view wealth and health as interrelated concepts and to develop strategies that promote both individual well-being and the well-being of society. A holistic approach, taking into account economic, social, and health aspects, is crucial to achieve sustainable development and promote prosperity for all. Section 2. The impact of wealth on health. Numerous studies have shown that wealth has a significant impact on a person's health. People in affluent backgrounds tend to have better health outcomes compared to those in poor backgrounds. Prosperity gives people access to quality medical care, nutritious food, safe environments, and opportunities for education and personal development. These factors contribute to improved health and overall well-being. A retrospective study conducted by researchers from Harvard Medical School at Brigham and Women's Hospital in collaboration with the London School of Economics and the University of Texas Southwestern Medical Center examined the associations between wealth mobility and long-term cardiovascular health. The study found that negative changes in wealth are associated with an increased risk of cardiovascular events, while positive changes in wealth are associated with a reduced risk. These results were published in the journal JAMA Cardiology. The study used data from the Rand Health and Retirement Study, HRS, to analyze longitudinal changes in wealth. Unlike most studies, HRS categorizes wealth data in detail, collecting information about both housing, principal residence, mortgages, home loans, and non-real estate wealth, vehicles, businesses, stocks, mutual funds, checking and savings accounts across multiple interviews. The study included 5,579 adults aged 50 years or older who had no cardiovascular health problems at baseline. Between January 1992 and December 2016, data on new diagnoses were collected through interviews with participants. For deceased participants, next of kin were interviewed and the National Death Index was consulted for additional information. The results showed that an increase in wealth is associated with protection against cardiovascular disease, while a decrease in wealth is associated with increased cardiovascular risk. Decreases in wealth are associated with more stress, fewer healthy behaviors, and less free time, all of which are associated with poorer cardiovascular health. It is important to note that the study has some limitations. All interviews and reports of new diagnoses were self-reported by the participants. In addition, there are many factors that affect overall cardiovascular health, including environmental and socio-demographic variables, that were not captured in the HRS and therefore not included in the study. Another study entitled Health, Nutrition, and Prosperity. A microeconomic perspective, published in the Bulletin of the World Health Organization, also examines the link between health and economic prosperity. It is pointed out that there is a positive correlation between health and economic prosperity. Some randomized studies have shown that nutrient deficiencies, particularly iron deficiencies, can reduce work capacity. In addition, observational studies suggest that general markers of nutritional status, such as height and body mass index, BMI, are significant predictors of economic success. Existing studies show that wealth has a significant impact on health. Access to appropriate medical care, healthy nutrition, safe environments, and educational opportunities are important factors that contribute to better health outcomes. However, it is important to note that wealth is not the only factor, and there are other factors influencing health as well. Please note that the above information is current as of 13 July 2023, and further research on this topic may be published in the future. The impact of health on wealth is an important issue that is of both individual and societal concern. Good health is a valuable asset that enables individuals to pursue education, find employment, and actively contribute to society. Healthy people are more productive, have lower healthcare costs, and are able to fully participate in economic activities. In addition, a healthy population contributes to the overall development and prosperity of a nation. Studies have shown that prioritizing health can also have a positive impact on economic prosperity. Before the COVID-19 pandemic, health was often neglected in discussions of economic growth, and the focus was often on controlling healthcare costs. However, studies have shown that poor health costs twice as much annually as the impact of the pandemic on the global economy. In fact, premature deaths and the loss of the workforce due to health problems account for about 15% of the world's gross domestic product. The costs of ill health can thus have a significant economic impact. Better health can promote economic growth in a number of ways. First, a lower mortality rate causes the working age population to grow. When people are healthier, absenteeism due to illness decreases, and workers are less distracted by managing their own health problems or those of their loved ones. In addition, fewer workers are retiring early due to health problems. Studies have found that better health could mean a $12 trillion increase in global gross domestic product by 2040, a growth rate of 8% or 0.4% faster per year. These gains could not only contribute to the economic recovery from the COVID-19 pandemic, but also counteract the demographic challenges of an aging population in the long term. Investing in health can also strengthen a society's resilience. The COVID-19 pandemic has shown that those with existing health conditions, such as diabetes, high blood pressure, and obesity, are hit the hardest. By leveraging the knowledge we have today, we can improve population health while dramatically improving the quality of life for millions of people living with chronic conditions. Studies have shown that proven actions, such as promoting healthy behaviors, access to primary health care, and improving medication adherence, could reduce the global burden of disease by 40% over the next 20 years. This would result in significant benefits, such as a 65% reduction in infant mortality and 230 million more people alive in 2040. Businesses have a special interest in investing in health as this creates a rich network of businesses, suppliers, employees, and customers. It fosters healthier employees with better skills and greater productivity, and wealthier consumers with greater income and purchasing power. Improvements in the vital conditions affecting health, wealth, and well-being thus create a favorable environment for private enterprise and contribute to strengthening the local network of enterprises. There is a link between unfulfilled vital conditions and poor health and economic inequalities. The unfulfilled vital conditions, such as lack of economic opportunities, affect the life opportunities of those living in such environments. By improving vital conditions, health, prosperity, and well-being can be promoted and socioeconomic mobility improve. Investing in educational opportunities and economic opportunities can both improve health and be a promising strategy to promote socioeconomic mobility. In summary, health has a significant impact on wealth. Individuals and societies benefit from good health as it leads to increased productivity, reduced healthcare costs, and active participation in economic activities. Investing in health can not only fuel economic recovery, but also contribute to a nation's long-term prosperity. By empowering the vital conditions that affect health and well-being, businesses can play a positive role by investing in communities while promoting their own and the economy's success. Section 4. Achieving a balance. Striking a balance between wealth and health is crucial for sustainable development. This requires a multifaceted approach that takes into account economic, social, and environmental factors. Governments, health systems, and communities play a critical role in promoting health and well-being while promoting economic growth and the equitable sharing of resources. Investments in health infrastructure, preventive measures, and health education are crucial to ensure that wealth and health go hand in hand. In order to provide an extensive and detailed answer on the importance of balancing wealth and health, we can refer to various sources. The Healthy People Initiative 2030 in the U.S. is an example of an initiative focused on promoting health and well-being. The Healthy People Initiative is a collection of national goals and measures aimed at improving the health of the population. Its latest issue, Healthy People 2030, emphasizes an expanded focus on health and well-being for all people. This approach emphasizes that health and well-being is a shared responsibility and that evidence-based interventions and measures are needed to improve people's health and well-being. Another approach to promoting a balance between wealth and health is the idea of a well-being economy. A well-being economy strives to promote social welfare and environmental health by putting the needs of people and communities at the center. Rather than relying solely on economic growth, a well-being economy aims to restore a harmonious relationship between society and nature, distribute resources fairly, and create healthy and resilient communities. This approach recognizes that a preventive approach to social and environmental problems is necessary to address the underlying causes. Health equity is another important aspect in achieving a balance between wealth and health. Health inequalities caused by social or economic disadvantage, geographic location, and environmental factors are avoidable differences in the burden of disease, injury, violence, or the ability to achieve optimal health. Many population groups, such as members of certain ethnic minorities, people with disabilities, or people with low socioeconomic status, experience such health disparities. Successful promotion of health equity requires collaboration between community organizations, employers, health systems, policymakers, and public health authorities. Integrating the concept of health equity into programs, policies, and databases can aim to eliminate health disparities. In order to achieve a balance between wealth and health, different levels of society must work together. Governments should promote policies and programs that address both economic growth and health and well-being. Health systems should invest in health infrastructure and promote preventive measures to prevent disease and improve population well-being. Communities can contribute to the promotion of health and well-being through educational initiatives, healthy environments, and social support systems. Overall, achieving a balance between wealth and health requires a holistic approach that considers the needs of individuals and communities. By investing in health, education, and social justice, we can promote sustainable development where prosperity and health go hand in hand. Summary: wealth and health are closely linked. A prosperous society provides the necessary resources and opportunities for individuals to maintain and improve their health. Conversely, good health contributes to personal and societal well-being by enabling people to reach their full potential. By prioritizing wealth and health, we can create a sustainable future where individuals and communities thrive. The relationship between wealth and health has been highlighted in various studies and reports. According to a 2023 McKinsey report, improving health is a powerful catalyst for economic growth. Over the past century, advances in areas such as vaccines, antibiotics, sanitation, and nutrition have saved millions of lives and fueled economic growth. Better health fuels economic growth by expanding the workforce and increasing productivity. In addition, it brings immense social benefits. A Canadian Medical Association, CMA, study found a significant association between earning at least $60,000 a year and good health. Among those with higher incomes, 66% reported good or excellent health, while among those earning less than $30,000, fewer than 40% reported being in good health. The United Nations Sustainable Development Goals, SDGs, set in 2015, are also committed to promoting prosperity and health. The SDG include goals such as eradicating poverty and hunger, ensuring quality education, promoting sustainable economic growth, and combating climate change. They recognize the close connection between wealth, health, and environmental protection and emphasize that decisions and actions in these areas are linked. It is important to recognize that health and wealth influence and reinforce each other. A wealthy society can provide resources for building an effective healthcare system, while good health gives people the opportunity to reach their full potential and actively participate in economic life. Individuals, communities, and governments should therefore pursue both prosperity and health as priority goals in order to create a sustainable and prosperous future.